Institute in Rawalpindi some 8 or 9 years ago, and he's moved on in a huge way since then. Faisal's about to log in to give his talk. He's been involved with something this morning, and we just got our wires crossed with times. So I'd like to introduce our second speaker first, who will tell us about his experiences. So he has championed the cause of transplantation in Pakistan, and there's no better way to champion this than to set an example. And he has set the ultimate example of being a living liver donor. So it gives me great pleasure to introduce to you for a period of 15 or 20 minutes, Mr. Justice Babar Sattar. I do have to seminar, and my colleague Dale Gardner from NHSPT will co-chair this with Satya Sharma. Dear Justice Sattar, please go ahead.
Thank you very much. So I'm a lawyer by profession, and my mother was the liver patient who received the liver from me. In terms of background, I think our story, it's been 11 years since the transplant, so it's a happy story. But as we were going through it, there was considerable pain and suffering. I'm sure that's the experience of most families who go through something like this. So my dad was a lawyer and a judge of the Lahore High Court here in Pakistan. And he died at 50 very suddenly because of a cardiac arrest. At the time we were much younger and very fearful that we've lost one parent. So we got our mother thoroughly checked for to make sure she was in good health. As part of that process, she went through some tests at a public hospital, and it later turned out that she'd picked up hepatitis C during that testing, unfortunately. She went through 2 interferon treatments. The first time I went alone, and the second time combined it with I'm not a doctor, so please forgive me if I spell these things incorrectly. It was probably ribavirin, but those 2 treatments, she Hep C came back. I was practicing as a corporate lawyer in New York City at the time, and we decided as a family that there's 2 of us brothers, and one of us should be back home to look after my mom. And so I came back, and at some point in 2009, our doctor thought that it was a good idea to subject her to a 3rd treatment. Subsequently, we found out that wasn't a great idea, because there was a good chance that her cirrhosis would accelerate. And up until then, we had no idea that liver transplant was an option. She was being treated by hepatologists, and the sense was that, with drugs and stuff, her life will be compromised, but she will continue to go on. 2010, her health, after the treatment, in the middle of the treatment, it had to be stopped because she was swelled up. So our experience is quite bad. I don't want to badmouth doctors here, because they've been tremendous doctors who really have to the option of transplant, really. Hepatologists that we consulted. An option. Liver transplant actually Pakistan at the time, because Dr. Faisal Dar not returned to Pakistan, and Pakistan didn't have a transplant unit set up. In any event, a doctor, Hassan, who I think now works with Dr. Faisal Dar, he explained to us that liver transplant was, and we could go to Europe or India or China. Those were the three main options. The US was an option. But he said that most people opt for, from here, they opt for UK or China, and the options spoke to us. Um, I was getting, and so after this, and my mother felt really ill. She was taken to a hospitalist at that time. When I went and met her, a couple of months, not called. But he was returning back to Pakistan to help set up this transplant unit in Shifa yet. So we very labs to various doctors across our issue, because my mother was very unwell and she could actually go visit for a visa, and there was, as we were told, that she could get a visa, a medical visa, without leaving the embassy. So at some point we had to rule out going to UK. Had made an appointment for January of 20 for surgery in UK. We looked at China. Didn't have where we could visa to go to China. Go to China for transplant surgery. Then we went on a visit. Couldn't really walk at that point. She was quite confused. She was in a by then. Process of exclusion really came. And that to actually manage to get to India. At the time, thankfully, the relationship between India and Pakistan was slightly better. Still getting medical visas, and we Apollo Hospital, where there was Dr. Subhash Gupta, who was an excellent surgeon, transplant surgeon. He'd done, I think, over 500 transplants by then, and a great guy, and now a friend. So we made arrangements to go there. Prior to that, obviously, there was the whole issue of who's going to donate. And so it was my brother or myself had fatty liver. And so we were told that he is not. I got my tests done at Shifa Hospital and got the results and sent them to Dr. Gupta in India. And he looked through them, and I still remember the most. And he called back and said that I was eligible to donate. What we were going to end up doing in Pakistan at all, or cadaveric, but in the event, others, but they were all 60, and they weren't necessarily eligible to donate, and other factors, and so that was one of the at the time. In the event that I wasn't able to donate, then what is it to do? And I'm not sure if it was there at the time, but I think it came. Then it prevents, other than a family, but are still indigent, who need the money. That you're a family with family tie documentation built up, from what I recall. clear that I was eligible. We were really unwell, and it was in capsule medication. I forget where, probably India, and to be able to sustain a flight from Lahore to when we got to the hospital, the doctor told us that her pumping, and it could have been a problem with the heart. It would just settle down with medication. With medication over a 13-day period, we went into and what I was going to was more about, sure that we get to a place where we were extremely desperate at the time. Call was newly married. Then I'm talking about early 2000 first baby, and so there was some anxiety in the family, but the surgery and to tell me that the surgery was recovering and that I'd be fine too. The first week in the hospital, some pain, and this used to stay up during the night. Night times were hard. They would give me nightmares. By the second day, I kind of figured out that even I was as, but like in a week, I recall for. Then she was also recovering. Rented. We had some very good without that kind of family. A couple of people. I was unwell myself. My mother was unwell and recovering, and caregivers and that. Long story short, 2 months into, we landed in India. We were one more time checkup. Great trip because we were much better. We could at that time because we spent. I'd be qualified, worried for my own health. At the time when we got out of the transplant, and if they looked after themselves, and thankfully it's been 11 years. My mother is to Saudi Arabia right now. In the initial 6 months, there was as I could develop her and do other stuff. But after 6 months, into I get regular where the surgery was done. When I go for swimming with my boys, that we should tell that day back in which I was caught up. It wasn't as funny. All this happened. She was trapped, got mixed up. She got very sick again. There were transplant center in Shifa. Thankfully, by then, Dar was in, and she was really but Dr. Dar in survived, and ever since, Dr. Dar is our first port of call, and thankfully they've been Dr. Subhash in India, and then Dr. Faisal Dar with his excellent team at Shifa have been our lifeline. And every time, even COVID-19, the question, a transplant patient can get vaccinated, vaccine, etc., and it's an effective transplant. Liver transplants in Pakistan, eligible for any reason of an effective donation program, organ donation program in Pakistan, and the absence of the ability to have a cadaveric transplant for 2 days till I found out that I'm very happy that ours is a happy story. In time, it was my mother's lived on. It's been 11 of my brothers that she's enjoyed over the last, and she still enjoys story. Thank you very much for
listening. That was a very help. Thank you, Mr. John. Met me on the call. I'm Dale Gardner. Obviously, Professor Mirza, as we heard earlier. The panel question is of a son's love for his mother, and it's a very powerful story for absolutely sharing that. He's been leading in Pakistan, doing is just quite astounding. HPB surgery. Join us. Sorry about the confusion of the timing, and we'll your slides. We can.
Yeah, thank you very much, Dale. Can everyone hear me well?
We can hear you fine, absolutely fine. We see you well.
Yes,
too.
It's all fine.
So after Justice Babar Sattar's story, I would like to share my story and how I started and how the journey has been. And thankfully, like Babar, it has been a happy ending for me as well. So it was from 2003 to 2010 when I was doing my training at King's College Hospital in London. Can you share my slides as well? See my slides as well?
We can see them. All we need you to do is just to launch the slides, because we can see them in sort of preparation mode. So just say start, slideshow start. Either the bottom button at the bottom, or just the slideshow at the top, and go start from
slideshow.
Yeah. Yeah, not now. And just try again, go slideshow from beginning. Perfect.
Okay. So
no, that hasn't quite worked. Try again. Try from beginning again. If Faisal, you just do the from the beginning.
It's working on my screen though.
We can see them okay. Probably just progress as you can. We can't see them advancing. I can see them on the side, okay. 1, 2, 3, 4. Do you have another computer? Do you have another screen plugged in, like 2 screens?
Yes.
If you
switch that off, please.
If you disconnect that, it'll probably make it right.
Can you see that now?
At the moment, we've just yep, and now you're in presenter mode. So if you just display settings, just going to go from beginning again. Before you do that, to the right, use presenter view is to untick that to the right. Oh, yep, that's perfect. Do that.
Okay.
Keep going like that. Fantastic. Thank you, Faisal.
Thank you very much. So I went through my liver transplant training at King's College Hospital in London. And during those time, I got the opportunity to see Professor Thomas Starzl and Professor Icon. They are the forefathers of liver transplantation. And for those who don't know, Professor Thomas Starzl did the world's first ever liver transplant in 1963. And Professor Icon did Europe's first liver transplant, I guess it was in 1967. So meeting them was a great source of inspiration. And these were the times, I think it was 2008 or 9, when I was going through my training, but there was no signs that liver transplant will happen in Pakistan. So during our conversation, I asked Professor Thomas Starzl, would I be able to start a transplant program in Pakistan? And this is what he answered, that you are a nuclear nation. You do have an atomic bomb. Why can't you start a liver transplant program? So I think that motivated me a lot. And I thought, yes, a liver transplant as compared to starting a nuclear program. So I decided that one day, once I have completed my training, I will go back and at least make an effort to start a transplant program. And my mentor at King's College Hospital was Professor Nigel Heaton and Professor Mohammed Rela. And when I was saying goodbye to them by December 2010, and Professor Heaton was trying to console me that, Faisal, don't worry, even if it takes 5 to 6 years, you just need to keep going. And I thought, oh, it's going to take 5 to 6 years. So that was the kind of start when I landed in Pakistan and started to work around the liver transplant program. Setting up this transplant facility, actually in any clinical facility, is, I think, is a big endeavor. And it's made even more so that exist. And I remember when I was walking around the corridors of the hospital, and most of my senior colleagues would say that liver transplant is not going to happen in Pakistan, and this guy is going to run away in few days' time. So the planning in a proper scientific manner, then there is a lot of groundwork which we have to do before actually starting the transplant. And once you start the transplant program, I think the more importantly was making it sustainable. So to start and then to make it sustainable, you need to have a right approach. And coming in Pakistan, where transplant facility does not exist, I was not sure what is the right approach and where to start. So I looked around that how I can start. So in any clinical facility where you are planning to start a transplant program, I think it's any clinical facility is just like a pyramid, where you have like maybe 60 to 70% of the day-to-day cases, which majority of the decent and good hospitals are providing that service. And then you have a tertiary care hospital, which are providing the specialty services. And then you have just the tip of this pyramid of very complex cases, and maybe few centers nationally are performing these sort of cases. And that was the picture of Pakistan back in 2010. And I tried to look at our pyramid of liver surgery and liver medicine. And I thought a hospital which I'm going to select, they need to have these basic minimum things already in regular service before I can start think of a liver transplant. So I visited 3 major cities of Pakistan, like Karachi, Lahore, and Islamabad. And Shifa International Hospital in Islamabad was the hospital where I thought that I can deliver this tip of this. Start a transplant program, the first thing was to have a basic or a minimum required infrastructure. Then you need to have the support services. Obviously, liver transplant is a very complex operation. You need all the support services to support you. And then you need to have a regulatory mechanisms as well if you want to start and then make this transplant program sustainable. So you have to look at the current status of that organization where you are going to start this program. And then you need to look at the minimum standards which you need to start, or minimum safety standards which needs to be there in that organization where you are thinking to start a transplant program. And then you need to work your way towards the ideal standards. So you have to quantify the difference and then move slowly from current to minimum, and then obviously to the ideal standards. And that is what, in my view, is the scientific planning. So the first and most important thing you need to create on the clinical side is a multidisciplinary team. At that time, the culture of a multidisciplinary team does not exist in our country. And in a private sector, where different clinicians are absolutely autonomous, making them work together under the umbrella of a one multidisciplinary team was itself, or can itself, become a task. So these are a kind of a professionals which were grouped together, and they start slowly working together in the form of a team. And then putting your business case to the management is a real challenge as well, because the management in a private sector is always worried about the outcome, especially the fear of disrepute. If the first few of your transplants are going to die and the outcome is not that good, it can be a major blow to the organization. And especially if, God forbids, there is a mortality in the donor, the program and even the hospital is over. And as we all know about the widely publicized donor death in Mount Sinai Hospital in 2002, when the Mount Sinai's transplant program was closed and Professor Charlie Miller lost his job as well. So this is a kind of scale of issues you have to think of, and a business organization would also have a fear of this disrepute. And this is a complete different area to develop, and the management has a lot of anxiety for that. And there is an element of professional sulking. And you know whether all these professionals and management will come along together, because liver transplant is a cohesive team effort. You need a lot of manpower, and then you have to train. And there is a huge cost, and the private sector always look at the return on investment. So you have to sell your business case well to the management to start this new complex facility in a private sector. And these were all the challenges which I have to face. So in the beginning, most of the workup actually which you are doing to set up this program is not visible to so many people. And at times, a person who is at the helm of affairs and trying to establish this program actually seems like not doing much. And it can be very frustrating. So I think important thing is the person taking such an endeavor needs to have the ability to face all this criticism with aplomb and should not be discouraged during this dry phase of setting up a transplant program. Or externally, like internally, you have a lot of colleagues who will be the part of the decision making, whether it's patients or a transplant payer's decision making, or it's the management decision making. A lot of people will be involved, and you can be just stuck in a lot of meetings, a lot of protocols, and the things just actually keep lingering on and on and on and on. Your patients is ready, but will be delayed by different professionals. The people will not come along into different crucial meetings, and it just makes you frustrated on a daily basis. And externally, the outside physicians will get a negative feedback from your in-house because you are a new team, and this negative propaganda actually dries up your referral base. And similarly, these sabotagers actually will convey a negative propaganda to, at times, the financing agencies, which can be government at times or insurance companies. Then you have a professional competition actually as well. And sadly, in this part of the world, people are not that honest about the results or the outcomes, and people would be claiming 100% success rate or a very low complication rates, no donor mortality, or a very minimal or a low donor morbidity. And if you want to be absolutely truthful and honest and tell them the real complication rate, you can be actually looked down upon, that you are not competent enough or your center is not competent enough. And this has been actually a challenge in the early part of the program. And then transplant beyond the normal indications, especially for cancer patients who are beyond the normal standard accepted criterias. You will get pressure from the patient, from the families, because we are a very emotional society. Even the patient has a very advanced cancer, the families will push you for a transplant, even if there is maybe 1% or a 5% chance. And to making them convinced that this sort of small chance of success is not worth it, putting the donor through the risk, it can become a challenge. And family will push you a lot, and then you can get political pressures as well. Kickbacks, not related to the transplant indications, but about the donors, organ trade, transplanting beyond indications, or a referral system has been all the problems in the early phase of the transplant program. And then if you are in a government sector, there is a lot of actually red tape, and the regulators want too many things from you, a lot of paperwork, and you have colleagues, you are actually constant looking at you to make you bring you down. And actually, all this in the beginning seems impossible. But in my view, most of these impossibles can be broken down into smaller possibilities. And things just don't happen. Things are made to happen. You just have to do it at the end of the day. You need to have a very clear strategy. You need to build a team, be inclusive and delegate, give ownership to people. You have to identify your friends very carefully, and you have to choose your enemies very carefully as well. You need to use the charm offensive, not confrontation. You need to have regular meetings, and most importantly, you need to avoid the hangover. You have to lead by example, because the whole team is actually dependent on you on the early part of the program. You need to avoid burnout. You have to manage the public and the patient expectations. And you have to remember that victory has 100 fathers and defeat is an orphan. If you are a failure, and if you can build a team, you can deliver, actually everybody will come along with you. Once you have delivered and started the program, I think the most important thing is making it sustainable. And I like this quote that if you want to start an educational program, first thing you do is to establish a world-class library. And if there is a money left over, then you hire some teachers. And that is the dilemma, unfortunately, of countries like us, where we do spend millions and billions on infrastructure. But once it comes to training and developing the human resource, our resources are actually dried up. And once the team delivers, making them sustainable, there is all and pull between the management and the professionals. Professionals want to be incentivized so they can do more work, and management is always there to squeeze them. And this is a story of the private sector, and I leave up to you to decide that who is in a driving position. Management believes that everybody is the same, whether it is just a doctor who is providing an outpatient consultation or somebody who is operating with a 10 to 20% mortality risk, with a huge risk of later on being sued as well. So they don't want to treat professionals differently. And then sustainability, in my is not incentivized, the program, you can start, but it will fizzle out if the team is not incentivized on a regular basis. So we did our first liver transplant 10 years ago. It was 28th of April, 2012. This was a 7-year-old child at that time, I think 7 or 8 years old. He was a very precious child, a son after 7 daughters. He was transplanted, and that was the start of liver transplant team by an indigenous team in Pakistan. So then we completed our 100 transplants and published our experience in liver transplantation. And Shifa International Hospital's liver transplant program actually was the mother program. It's not only started the transplant in Pakistan, it actually trained so many transplant surgeons, transplant physicians, intensivists, OR technicians, nurses, transplant coordinators. So in about 10 years' time, 15 transplant surgeons was trained by this program. And I would say at least 200 to 250 people who were the part of the transplant team was trained by this center. And these were the trained people who then later on moved to different centers. In 2016, I was asked by the Transplantation Journal to give an update about the transplant program in Pakistan. And this was the state of affairs on the left-hand side. The Shifa International Hospital transplant program was leading with nearly 400 transplants at that time, and there were 6 transplant programs at that time. And on the right-hand side, this is the latest state of affairs in Pakistan, that we have 10 transplant centers, and almost 2,500 transplants has been done in the last 10 years. And this is all, or majority, by the indigenous teams who were trained at the mother program in Shifa International Hospital. And it is actually ever growing. There has been a huge interest in the young surgeons to get training in hepatobiliary and liver transplantation. And a lot of ICU and anesthesia people has come along to get training and then moved on to other centers as well. So in summary, to set up a liver transplant program, you need a very clear leadership. You need to have the right approach. You need an absolute discipline, especially in the early part of the transplant program. The management need to have the patience because they have invested so much and they want the return on their investment. But I would say it takes at least a couple of years for the transplant program to become sustainable, and then you will have a lot of revenue from the program. You need to define your timelines very clearly. You need to audit your progress. You need to reward people, and you need to have an element of punishments whenever there's a breach of discipline. You need to dedicate your resource and time for training and research. Team building is the key, and you have to transfer all this knowledge and skills to the next generation. So I think coming together is the beginning. And these are the different people, starting from the international faculty to the local faculty, different politicians, philanthropists, and breed of young transplant physicians and surgeons, who in my view have all contributed to the development of a sustainable transplant program in our country. And I think I would like to thank all of them for their contribution to the development of this field. And at the end, I would like to thank all of you for your patient listening. Thank you. Dale, I'm done.
Indeed, we're just letting Sattar Sharma, if you just stop sharing your screens, Faisal, and Sattar's going to take over the questions for the next step. Thank you very much. That was fascinating.
Thank you for your help. Thank you. And I must give comments. So Thank you for all the positive. I'll just like to use the time for questions. Honourable Judge, the information were you given about risks to get informed consent? And there's another question. Good enough. Did the team have sufficient time so that you could digest all this? Mr. Sattar first. Can you unmute yourself, please?
Yes, I think in our case, because there wasn't a transplant, but when we wound up in India, I went through a psychiatrist evaluation, board constituted to determine whether the consent was valid and forthcoming, and slight analysis by two psychiatrists who wanted. I was trying to be a donor. I was explained the risks quite candidly, and I think there was focus in Dr. Gupta on explaining to me what could be very well taken care of.
Story, it has been very impressive. There have been a lot of positive comments, and your love and affection for your mother is absolutely overwhelmingly powerful. One supplement: what did you find most helpful when you were going through the anxiety state of what will happen to my mom, what will happen to me?
I think team just time to answer questions. I thought that was a big change from the manner some us in Pakistan versus because we had, I'm sure, which the doctors thought were silly questions. Them just taking the time himself coming in and why is it that they were doing what they were doing? Days when we were waiting for my mother to just be able to be to undergo the surgery, how the anesthesia would work for me to get out of the hospital, what I could eat and drink afterwards, how long I'd be able to exercise, what precautions to take. I think that kind of care, and also the medical care. I thought the nursing care for the first when I was quite helpless. I think that was extraordinary. There was it was professional, it was extremely kind. They were extremely kind to me, I felt, and I thought that was whose other being in a hospital, somebody helping you, and obviously family huge. The caregivers were related, and there I think huge difference. Thank you.
Thank you very much. I hope that you're able to stay for a little longer, because this now started a little bit late and perhaps we lost a bit of time. So I would not want to cut the questions, not want to reduce the value of the question answer session, which is so. So coming on to Dr. Dar, presentation, they are all good and with praise. Let's, which may be helpful to everyone. What do you think? Why is it that other countries can't follow the example of Pakistan? Because Pakistan did so very well. And a related question is, do you have liver donor transplantation program? Yes.
Yeah. No, we don't have a deceased donor program yet. I think interesting when you are in the Western world and doing the disease fantasy. I mean, it's the highest level of the surgical skills where you want to deliver. But because they have such a strong disease organ donor transplant program, that at times itself is an impediment to the development of a living donor transplant program in the Western world. Here, we don't have an option. Transplants for more. I would love to do the disease organ transplant because it's much safer. Because myself actually maybe have grown 10 feet than my actual age because of the pressure which you take all these years. But having said that, in terms of setting up, I think living donor transplant program, the setup is much easier as compared, because all you need to 20 members team of and committed to each other. You need a supporting structure by the management, and then you can deliver living donor.